Dr. Leena Jain, a renowned reconstructive and plastic surgeon practicing in Mumbai Leelavati Hospital, Jeslo and Rich Candy. She is also a director at Plastico Clinic, Borivali. Dr. Leena, you have 10 years of experience in burn deformity correction, neck contractures. What do you consider is the best ideal treatment?
Neck contractures can be very debilitating for patients because unfortunately most of these patients undergo a skin grafting as a basic procedure. That's done like across the country and across the world. However, it is less than ideal a procedure for neck contractures because any kind of grafting will cause a recontracture. Plus, aesthetically, it looks really ugly to have a dark patch across your neck because neck is of course the exposed area of the body. So what I consider an ideal treatment I offer to my patients is doing a flap for the neck. It's usually a free flap wherein we take tissue from the thigh or from the side of the chest and we resurface the entire neck with that tissue because that's a perfect match with the rest of the color of the neck. And the surface of the skin in a flap is absolutely smooth. So the contour and conformity to the natural angles of the neck is really smooth and nice. So the ideal treatment is doing resurfacing of the neck after release of a complete contracture with a free flap.
Dr. Leena, breast reconstructions patients are having, myths or anxiety that they have to go undergo a surgery again. What would you suggest? What is your opinion on it?
So the ideal time to do breast reconstruction is at the same time during which the breast is removed for cancer surgery. That is at the time of the mastectomy. So that's called primary breast reconstruction. Patients are very anxious thinking that they're undergoing surgery of two different body parts. Like, the cancer surgeon removes the breast and we reconstruct with tissues from the abdomen. But think of the long-term goal. It's a single surgery, single anesthesia. Just the duration of surgery increases by 3 to 4 hours and your stay increases by 3 to 4 hours. But you're walking out of the hospital with a newly reconstructed breast looking absolutely symmetrical within the clothes. So your femininity is restored under one anesthesia. So I don't think there's anything to be anxious about it. It's just a little more clarification that patients need and a reassurance.
Yeah, and this reconstruction, of course, is very beneficial to the patient.
Definitely.
There's patient's confidence.
Absolutely.
Post-recovery.
Psychologically and emotionally, it's a big boost for them.
So, Dr. Leena, some patients have this thing, I have big breast, or they are unable to decide for themselves, is their breast size perfect?
Right.
So, what do we do in that scenario?
So, the best judge or decision maker that whether one needs a breast reduction or not is the patient herself.
Okay.
Because she is the only one who can comprehend the physical, emotional and psychological impacts that are associated with a heavy breast. If she's unhappy with her body, then she needs to undergo surgery. And trust me, breast reduction is an extremely gratifying procedure. The patients are greatly relieved with the physical or mechanical issues that they cause on the back and the neck. The psychological impact of not, finding a simple normal bra of their size or not being able to wear a crop top and things like that. So, all in all, it really improves their lifestyle. It improves the way the patient can dress up at work or at leisure and the way the patient can carry herself. So, again, breast reduction will greatly impact her life overall and her confidence.
Yes. So the same way how breast enlargement makes you more confident, similarly breast reduction also gives a very typical impact. Dr. Leena, hands are commonly affected during burns. What do you suggest when there is no hand movement or something? What do you suggest and what treatment do you go ahead with?
Hand burns are quite commonly affected during any kind of burns, most of during thermal burns or even blast injuries. And the basic reason why we have hands is for function. Basic functions like, being able to drink water with your own hands or being able to eat with your own hands. So the goal of hand deformity correction or hand contracture release is to give a functional hand. It does involve a lot of microsurgical work, a lot of release of contractures, resurfacing with flaps, doing toe transfers sometimes, releasing the web spaces so that the joints come into a functional position, enabling the patient to use his hands for basic hygiene and being independent.
Dr. Leena, diabetic foot ulcers. What decides patient's ability to walk?
So, when we consider diabetic foot reconstruction, the ultimate goal is not just to prevent an amputation, that is to save the foot per se, but also to enable the patient to use the foot for walking. So, reconstruction essentially in a diabetic foot involves either grafts or flaps, depending on where the ulcer is. And if the ulcer is on the heel-bearing areas, then we need to do flaps. Subsequently, we give modified footwear, and we make it a point that the patient walks in a month's time following surgery. So that way reconstructive surgery has also really changed the face of the rehabilitation in a diabetic foot patient.
That's quite relaxing then to the patient.
It's extremely relaxing, relieving, and at least it avoids an amputation and it makes the patient functional very quickly.
So Dr. Leena, few women have a pot belly appearance. What is the treatment you suggest and how fluent is the treatment?
I believe you're talking about women who have this appearance of being perpetually pregnant.
Yeah.
So, though they are not. So, the whole thing is that these patients usually have had a cesarean section in the past.
Okay.
And due to the pregnancy and the growth of the uterus, they have something called a divarication of the rectus, where the abs actually separate from the midline. And there's a big defect in the abdominal wall, which actually causes protrusion of the contents. So, in this case, tummy tuck is the ideal treatment, what we say abdominoplasty. Here, abdominoplasty is just not cosmetic, but is essentially reconstructing the lady's abdominal wall. So it reduces the protrusions of the abdominal wall, it makes it firm, brings back the abs in position, and reduces the entire overhanging fatty tissue. So it gives a very beautiful appearance and defines the waistline nicely, removes all this excess tissue, and restores the congruity of the abdominal wall.
Okay.
So functionally, actually, it has a great functional impact. It reduces the back pain and reduces the overall outcome that a woman bears with.
Dr. Leena, brachial plexus injury. What are the results of it?
So, brachial plexus, just to explain what it is a group of nerves which arise from the neck and go on into the neck and below the collarbone and supply the entire upper limb.
Okay.
So that is the primary source of motor and sensory supply to your hand, and your hand functions based on this group of nerves. So a brachial plexus injury means these nerves are not functional. That means the patient will not have shoulder movement, will not have elbow bending, will not have the ability to make a fist. So depending on what time they present after the injury, the blunt trauma that impacts the brachial plexus, we decide on the different types of surgeries. There are different types of nerve transfers which can restore the nerve function, or there are muscle transfers which bring about functions like elbow flexion, that means bending the elbow and making a fist so that the patient can hold a glass of water. So there are varied procedures available, and they're all time defined depending on the patient's presentation. But of course, brachial plexus surgeries are extremely beneficial and bring about a lot of functional improvement in these patients.
If you wish to have an online consultation with Dr. Leena for your reconstructive and plastic surgery, DM us and Clinicspots will arrange this for you.